Hello everyone, it's Dr. Nicole Rochester and I'm here with tonight's episode of Navigator Nuggets. For those who don't know me, I am a board certified pediatrician, a speaker, an independent health advocate, and the CEO of Your GPS Doc. And tonight, I just wanted to come and provide you all with some updates regarding COVID-19, okay? So if you have not watched my previous videos, I encourage you to go through this channel and just scroll through and look for those. We've talked about coronavirus off and on since March of 2020, and more recently I've talked about coronavirus vaccine hesitancy and medical mistrust, and I had the honor of interviewing a close friend and sharing her journey from no to yes to the vaccine. I've documented my own personal experience with getting the coronavirus vaccine. So I encourage you to go through the channel. And also there's a lot of other content on this channel related to just helping you navigate the healthcare system for yourself and for your loved ones. So let's go through just a few of the updates related to coronavirus. I want to start with something that's not actually an update. It's not really all that new, but I think that it's going to be new to many of you watching this video, and that is monoclonal antibody. I put a poll on my social media probably about a week and a half or so ago, and what I found is that I would say about half of the people said that they had heard of it, but then what I realized when I looked at the responses is that me being a physician, my social media audience is often kind of highly curated with other physicians. A lot of my friends and people that follow me are fellow physicians. But when I separated it out and looked at the responses from people who are not in medicine, the large majority of them said that they had never heard of monoclonal antibody therapy. So I want to start with that because in my opinion, this is definitely a potential health equity issue. Those of you that follow me, particularly those of you who have been following me more recently, know that I am a health equity champion, a health equity consultant, and it's really, really important to me that everyone has equal access to healthcare. And access doesn't just mean having an insurance card. It's way, way bigger than that, okay? So what I'm worried about when I found that a lot of people in my circle had never heard of monoclonal antibody, and I don't know if that information is widely available, if it's not making it to the minority communities, but either way, I just wanted to make sure that you all were aware. So of course, all the rave right now is talking about the vaccine, and we'll get to that in a moment. And of course, you are still hopefully hearing about public health measures that will help us to control this pandemic. But what you're not hearing a lot about in mainstream media is that we do actually have a treatment that has received emergency use authorization from the FDA, very similar to the process that the current vaccines that are available, that same emergency use authorization process. And we do have a therapy for COVID, and it's not, drinking bleach and some of the other ridiculous things that were shared previously, and we won't go into a lot of detail with that. You all know what I'm talking about. But there is a therapy for coronavirus, and it's called monoclonal antibody. So let me just briefly explain to you what that is. Antibodies are protein molecules that our body makes, that our immune system makes, our B cells, B as in boy, and we make those antibodies against foreign materials, so against bacteria, against viruses. And so if you become sick with any type of infection, one of the ways that your immune system responds to that infection is by making antibodies. And the antibody binds to what's called an antigen, which is that pathogenic particle or protein on that pathogenic particle. And when it binds, there's a series of things that happens that allows it to basically destroy that invader, and it allows us to recover, or in some cases to not even really be significantly harmed by these foreign invaders, otherwise known as viruses and bacteria. Having a robust immune response is incredibly important. It's one of the reasons why vaccinations work, not just for COVID-19, but for many of the other illnesses that we've been able to eradicate. But getting back to this monoclonal antibody. So what this is this is a lab-produced antibody. And so the reason it's monoclonal is that they have basically collected a single type of antibody against this spike protein that I'm sure most of you have heard about on the coronavirus surface. So if you were to draw my blood right now, you would find a lot of different types of antibodies. You may find an antibody to a stomach bug that I was exposed to 2 days ago, or maybe a cold virus that I was exposed to, and a number of other things, because our body is constantly being challenged and threatened by viruses and bacteria and all these other things, right? But with the monoclonal antibody, instead of just giving someone an infusion of a whole lot of different antibodies, some of which will be effective for coronavirus and some of which will not, this monoclonal antibody only includes antibodies that were specifically engineered to be against the spike protein, okay? So these antibodies were developed synthetically in the lab. And then what they do is they give them to you and it mimics your own body's immune system. It's actually brilliant if you think about it. So this therapy is actually available. And I want to tell you who it's available for and also how you get it. Because this is another key way for those who are already infected with COVID. This is a key way that we can prevent some individuals from getting seriously ill, from having to be hospitalized, from having to go on a ventilator, and even from dying, okay? This is for the following individuals. This therapy is to treat mild to moderate COVID-19 infection, okay? So it's not for the severe cases. It's not for people who are already like sick in the hospital. It's actually to be given at the mild to moderate stage to prevent you from progressing. But it is not approved for everyone, okay? So it is approved for individuals who are 12 and older, who test positive for COVID, and who are at an increased risk of progression to severe disease. So let's talk briefly about what those conditions are, who is at increased risk and who qualifies for monoclonal antibody therapy. Okay. These are the conditions: a body mass index greater than or equal to 35. So we're talking about obese individuals, chronic kidney disease, diabetes, any type of immunosuppressive disease, people currently receiving immunosuppressive therapy. So that may be people with lupus or other autoimmune conditions, or people with cancer, individuals who are 65 years of age or older, individuals who are 55 years of age or older and have either cardiovascular disease, hypertension, chronic obstructive pulmonary disease, otherwise known as COPD, or some other chronic respiratory disease, okay? And then individuals ages 12 to 17 years of age who have a BMI or body mass index greater than or equal to 85th percentile for their age and gender, okay? Or individuals 12 to 17 years of age who have sickle cell disease, or if they have a congenital or acquired heart disease, or some type of neurodevelopmental disorder like cerebral palsy, as an example, okay? Or if they rely on what we call technology, things like a G tube, which is a tube that they put in your stomach to help you to get your nutrition, or a tracheostomy, which is a breathing tube to allow you to breathe. So those are pretty long. You can always Google it. You can just Google criteria for monoclonal antibody therapy. You can Google that and you'll see the whole list. But I just wanted you to know that it is approved for individuals as young as age 12, but you have to have these other conditions that I listed, okay? So this is important because those conditions that I listed are basically the very people who are at increased risk of dying from COVID-19 and the people who are at increased risk of having a progression of their disease from COVID-19. And so it is incredibly important that those individuals and their family members know that there is a therapy for them, because ideally what we want to happen is that if somebody who is at increased risk of dying from COVID or having a severe outcome ends up testing positive, then very early in that process, we want to get them this therapy that has been proven to prevent the progression, okay? So now this is not for hospitalized patients, and it is not for individuals who are on oxygen. The other thing you need to know is that this therapy is an IV infusion, so you do have to go to a place where they're able to do an IV infusion, and each state has designated certain sites for this therapy. So you can't just like go to your doctor's office, and in many cases you can't even get it in the emergency room. So you will have to get it at a designated infusion center. The other thing is that this therapy must be prescribed by a doctor. And so your primary care doctor or your specialty doctor must enter a referral, and there's a special system in each state where they do that. So you can't just kind of go to urgent care or go to the ER and say, I have COVID, I have this underlying condition, I want you all to give me the monoclonal antibody infusion. You have to go through your doctor. And that bothers me to some degree because, we know that that's a barrier. We know that there are a lot of people who don't have primary care physicians, but because this therapy is it's very limited in supply, it's very expensive, and it's still in that experimental phase. I mean, it does have emergency use authorization, but it's otherwise still in an experimental phase. So because of that, they are controlling the conditions under which people receive it. But I just wanted you to know about it. I wanted you to hear it so that if you have a friend or a family member, or maybe this applies to you, and God forbid, you become ill with COVID, that early on you are eligible for this therapy. And ideally, it needs to be given within the first few days. If I'm not mistaken, they won't approve it after 4 or 5 days. So this is something that you need to act on very quickly. So again, I wanted you to be aware of monoclonal antibody therapy as a treatment for individuals with mild to moderate COVID-19 disease who have other underlying conditions that I mentioned, okay? All right, so that's the update for that. Now, let's get to the vaccines. You probably have heard that we now have a third vaccine that has been issued emergency use authorization by the FDA. I want to assure you and reassure you that because it has received emergency use authorization, that means that it has already been determined by a very rigorous process to be both safe and effective, okay? So let's talk a little bit about the Johnson & Johnson vaccine. Unlike Pfizer and Moderna, which are mRNA vaccines, and if you want to know more about that, scroll back and look at some of my other videos. This vaccine is called a vector vaccine. And so what this vaccine is they use what's called a vector to get that spike protein and get that protein into your body. So the vector that the Johnson & Johnson vaccine uses is adenovirus. Now, this is a very, very common virus that is widely circulating throughout the country and the world. It is a very common cause of the common cold. So many of us have been exposed to adenovirus. And what they did is that they made this virus so that it cannot replicate. So therefore, it cannot make you sick. But what they also did is they attached a gene for the spike protein, okay? And so what happens is when you get the Johnson & Johnson vaccine, that adenovirus that's attached to that gene for the spike protein goes into your body, goes into your arm, gets into your cell, and then that gene gives your body the instructions to make the spike protein. So now your mRNA is going to take those instructions, give them to your other cells, and your cells will make the spike protein. So just in contrast, really quickly, the other vaccines give you the mRNA that has the instructions for the spike protein. In this case, the adenovirus is attached to the DNA, and then that provides the blueprint for the mRNA that provides the instructions for your cells. But ultimately, both vaccine types do the same thing, and that is they teach your body how to make spike protein. And then what happens, as I've shared in other videos, is that your body starts cranking out this spike protein, and then your body's like, wait a minute, this doesn't belong here. This is not of us. And then all of those immune processes that I talked about kick in, and they begin to fight against those spike proteins. You make antibodies, your memory cells remember that spike protein, and they get rid of everything. And then if you are exposed to coronavirus again in real life, your body already knows what to do. As soon as it sees that spike protein, your body goes into action. Your immune system goes into action, okay? So one way it's different from the other two vaccines is that it is not an mRNA vaccine. Another way that it is different is that this is a single dose regimen. For the first time, we now have a vaccine that, for now, only requires a single injection. So we're really excited about that because it's going to allow us to quickly vaccinate so many more people and get them fully vaccinated as opposed to the current 2-dose regimens with the Pfizer and the Moderna, okay? Now, I will say that another difference is that the efficacy for the Johnson & Johnson vaccine is not quite as high as what we saw with Pfizer and Moderna. And there's a couple of things I want to make sure you know about that. One is that the Pfizer and Moderna trials took place when we didn't have high levels of circulation of these variants that we're seeing now from the UK, from Brazil, from South Africa, and even variants that we think are rising within the United States. So it's not unexpected that the newer vaccines are probably not going to perform quite as well just because of the variants, okay? But despite that, this is still a very good vaccine. 66% efficacy against COVID-19 globally, worldwide. In the US, if you look at the US participants in the trial, it was 72% effective. And if you specifically focus on moderate to severe disease, again, those individuals that are really sick, that need to be hospitalized, that are in the intensive care unit on a ventilator, 84% efficacy. That is pretty darn good, you all, okay? So what I would tell you is that we now have 3 really good, really safe vaccines for COVID-19. And like I've said before, and like all of the experts are saying, we do not want you to pick and choose. You won't even be able to pick and choose. We want you to get the vaccine that is available to you at the time that your number is called, okay? So when you are lucky enough to get an appointment for your COVID-19 vaccine, whichever vaccine is available is the vaccine that you should get, unless you have had conversations with your doctor or some other healthcare professional and you have underlying conditions that for some reason, they're recommending one of these vaccines over another. And I should add that none of this information I'm sharing in this video or in previous videos is medical advice. I am simply giving you information so that you can be empowered to make the best decision for you. All right? All right, and in terms of participants in the trials for the Johnson & Johnson vaccine were very diverse. They had 17% of their participants in the trials were Black. If you may recall that Pfizer and Moderna was around 9 to 10%, so this is actually really good. 45% of their participants were Latino, and 40% of their participants had at least one underlying medical condition, okay? So I think we can safely say that they had diversity covered in this vaccine. The other thing that I'll tell you in terms of reactions, which again are not uncommon and they're not dangerous and they are to be expected, they saw very similar things to what we see with Pfizer and Moderna. So soreness at the injection site is very common, and then some of their recipients had fatigue, headache, and fever. Again, the same things that we're seeing with the other vaccines. Those were the most common reactions. And again, that just means that your body is reacting to the vaccine. It does not mean that you got coronavirus from the vaccine, which is literally impossible. With the 3 vaccines and all the other ones that are being studied, you cannot get coronavirus from the vaccine. It is literally impossible, okay? And also of note is that in the Johnson & Johnson vaccine trial, as with the others, there were no vaccine-related deaths, not a single one, okay? All right, so I hope that this is helpful. I guess the final thing I will say is that they are studying a 2-dose regimen with the Johnson & Johnson vaccine, and to look and see if maybe the efficacy will be even better if they give individuals 2 shots, but for now it is a 1-shot regimen. They also are studying single-dose regimens with the Pfizer vaccine. They're looking at variants and trying to figure out whether we may need to get a booster at some future date because of the variants that are circulating. So there is a lot of activity going on in the science world. I'm really excited about that. Meanwhile, while you wait to get your COVID vaccine or while you think about it, and for those of you who have already received 1 or both doses of your COVID vaccine, please continue to follow all of the public health safety measures. You must continue to wear your mask. You must continue to practice physical distancing, at least 6 feet apart. Do not host gatherings. Do not go to gatherings. Do not spend time indoors without a mask with people who are not part of your household, and also continue to wash those hands. All right, you all, there is a light at the end of the tunnel. The cases are still way too high, but they're going down. The deaths are still way too high, and we've now lost over 500,000 people here in the United States. But thank goodness, those numbers are going down as well. So if we can just hold on a little longer and be patient and continue to do the things that will not only protect ourselves, but will also protect our neighbors, our family members, and our community, we will get through this, okay? Thank you all so much for tuning in. Again, I'm Dr. Nicole Rochester, founder and CEO of Your GPS Doc, board certified pediatrician, speaker, author, independent health advocate, and health equity consultant. All right, you all be safe, and I'll see you next time. Take care.